Hello, this is Mark with Sooner Care, and we're going to go over Journey of a Claim. Now, this is not submitting your claim to the healthcare authority. This is the process the claim goes through once it is received. So the disclaimer for our presentation today, this information is current as of June of 2020. You can keep up with current policy changes, globals, provider letters, anything you need on the public site, www.okhca.org. Speaking about policy changes, I do want to point this one out. This is posted on the public site right now. This is the claim submission update that was posted May 21st. When we started working remote due to the coronavirus, the healthcare authority requested that claims would be submitted electronically. So that would be through electronic data interchange, which is EDI. That is software, a clearinghouse, a billing agent that has a software, something like that, or the provider portal. The healthcare authority is requesting that the only paper claims you submit now are the special batch HCA 17 claims, which we're going to go over in depth a little bit later on. This presentation is going to be an overview of the process once a claim is received, and providers will learn about possible scenarios that can happen during adjudication, and if there's any issues, we'll give you some resolutions to that. The agenda we're going to talk about a couple of things that happen before the claims are submitted. Then we're going to go over the EDI submission claims, provider portal claims, the special batch claims. Members that have a primary insurance, those are third-party liability claims, and then how to do attachments and what claims need attachments. The second step is the adjudication process. We're going to talk about how the claim is assigned a number, the edits that the system looks at when the claim is going through the system, what happens once the claim has been processed, and we're going to look at the audits for the EDI and the provider portal claims as well. And then the final destination is the remittance advice. We're going to talk about where you can get that off of the portal as well. So before the journey begins, there are three ways you can submit a claim to the healthcare authority. One is through EDI, electronic data interchange. And again, this can be a clearinghouse that you use. It can be a billing agent that you use that has their own software, or it can be you submitting through your own software. There's also the provider portal. Every provider has access to the provider portal. And then we're going to go over the special batch HCA 17 claims, which again, the healthcare authority is requesting. These are the only claims on paper that you submit. You will be paid determining on when you submit your claims. So we cycle Wednesday at noon. You have access to the portal 24/7, 365. Occasionally in the wee hours of the morning, there's an update that goes on so that it won't be available to you, but most of the time you can you can open up your portal 24/7 anywhere you are, as long as you have portal access, internet access, and you know the username and password. When the claims go into the engine, they sit there until Wednesday at noon. They flip the switch. The claims then process and pay the following Wednesday. So if you want to get paid every week, you can just submit every week. You can do it every 2 weeks. You can do it once a month. You can do it whenever you want, as long as the initial claim is submitted within 183 days of the date of service. The referring number, the ordering number, the rendering number, any number at all, any provider number that you put on your claim has got to have a Sooner Care contract that is current for that date of service. And also, claims can only be paid to currently contracted Sooner Care providers. So the first step, of course, is getting the claim to us. So the provider, the clearinghouse, or the billing agency will upload the batch in the provider portal if you're using EDI, Electronic Data Interchange. Once it is uploaded into the system, once we've received the batch, it takes 3 to 4 hours for that process to go through and for the claims to be available to you to view on the portal. Sometimes on a Tuesday or Wednesday, there's heavy volume because, again, we cycle at noon on Wednesday. So on Tuesday and Wednesday morning, people are trying to get their claims in so they can get paid the next week. Each batch we receive is going to be assigned a 7-digit transaction number. That number will go back to the entity that submits the batch to us. And then also that entity will receive a 999 report letting them know whether or not their batch passed compliance. If you're using the provider portal, we just want to point out that any type of claim whatsoever, professional, dental, institutional, long-term care, behavioral health, claims with secondaries, any type of claim whatsoever can be submitted on the provider portal with the exception of the HCA 17 claims. Right now the system is not set up to receive those electronically. We are working on that. We're going to talk about that in just a second. Every provider contract is given a PIN that you can go in and set up your portal. If you need help with that or you need help being trained on how to use the portal, at the end of this presentation, we're going to give you some contact information where you can get a hold of one of the field reps, and we will be able to come out to your facility and help you or help you on the phone, whichever you prefer, whichever is better for you. We also want to point out all the claims that are submitted, the claims in the past that were on paper, your claims that you submit through EDI, your claims that you submit on the provider portal. All of those are available to you to view on the provider portal. If you are using the provider portal, there are several fields that have an asterisk. These fields are required for all providers. All the claims have to fill out those fields. Now, you might have a situation where because of your provider type or your service you're rendering, you're required to use an ordering provider, or you're required to use a referring provider for our Sooner Care Choice members. In that case, those fields would be required for you, but they don't have an asterisk because they're not required for everyone. If a claim claims that are processed on the provider portal will process immediately. So once you hit submit and confirm, it takes literally 3 to 4 seconds. Your claim will come back and say either paid, denied, or suspended. If it is suspended, that claim will go to the healthcare authority for review. And the provider portal is free to all contracted Sooner Care providers and can be accessed using an internet connection. And again, that should be available to you 24/7. Okay, I've talked about special batch claims a couple of times. Now we're going to go over those a little bit more in depth. Again, the healthcare authority is requesting that these are the only claims that you're submitting now on paper. Currently, these claims are required to be submitted. They have to have an original paper claim with applicable documentation. The claims are going to be reviewed on an individual basis. So you might submit this particular code and it will pay on this claim, but then you submit another claim for another person and it might deny it. It might have to do with the eligibility package. It might have to do with the documentation. So they're all on an individual basis. We are working right now on getting these special batch process claims available via the provider portal. So just stay tuned for updates on that. The special batch process continuing here. Remember that the healthcare authority, if you are going to drop a claim to paper, they only accept one-page paper claims. The professional 1500s and the institutional UB04s must be standard size and red and white claim forms. You cannot have more than 999 total pages. So you're going to have your HCA 17 on top. That is a form you get off of the public site. Then you're going to have your paper claim underneath that. And then you're going to have all of the documentation you're sending to support your review. All of that put together cannot be more than 999 pages. Remember that these claims are scanned into our system. So your print must be aligned within the boxes. If you have letters that are outside of the boxes, maybe they're a little bit to the right, or they're a little bit high or a little bit low, and some of it's cut off, then those claims are not going to be able to be processed. Remember that we do not accept crossovers on paper with the exception of the HCA 17 if you have to special batch them for some reason. And this is important. Legacy numbers, or your Sooner Care number, which is your number that starts with a 100 or 200 and ends with an alpha character. Those numbers are required to be on a paper claim. This is the number one reason we have to return claims to providers and the claims can't be processed. NPI numbers were made for electronic claims. So they're required for your portal claims and for your EDI, but legacy numbers are required for paper claims. So you have to make sure those are on there. Again, your claim must be the standard size red and white claim form. This is the standard ink. No, so if you just go to Office Depot or somewhere and buy your claims, this is the ink that's going to be on there. But if you are set up to print your own, you need to make sure this is the ink that you're getting right here. Your Sooner Care number on a UB has to be in field 57. That is your legacy number. And on a 1500 professional claim, 24J is the rendering, 33B is the billing. If your system automatically prints the NPI on the claim, that is perfectly fine. If you look on there, you'll see there are two sections, one for the NPI, one for the legacy number. So the legacy number is required. UBs require a bill type in field 4. And remember that bill types 121 and 831 are crossovers, so they can only be used on special batch claims. And make sure your ink is legible, there's no smudges, and it also does not fade across the page because, again, they're scanned. If they can't be read, they can't be processed. For our dental providers, you use the ADA 2012, which is a black and white form. That's fine. Make sure your HCA 17 is on top, then your ADA 2012, and then your attachments. Your fields for your Sooner Care number, 52A is the rendering provider, and 58 is the billing provider. So we've talked about what the special batch is and how to process it. Now we're going to talk about when you will use it. So these are the times we do need you to use a special batch. If you have two different rendering providers seeing the same member on the same day and the same entity is going to bill. So the first claim is going to pay. The second claim is going to deny as a duplicate. So you're going to have to get that denial, get your HCA 17, drop that second claim to paper with documentation explaining why that second physician was required to see the member same day, same biller. A physician claim with multiple visits on the same day. Somebody comes in and they're really sick. You treat them, they go home. They get much worse, come back again. You have to see them again. That second claim is going to deny, which is fine. You just drop it to paper, send your documentation, and explain why the member came in twice. If we have an ambulance provider out there and they have to go pick up someone and take them to the hospital, later in the day, they are called again to go get that same patient and take them back. The first claim will pay. The second claim will deny as a duplicate. In that case, we will need the claim drop to paper, and we need both ambulance runs. So when you send in that documentation, make sure you send us the first run and the second run. 2 ER visits on the same day, same process. First one will pay, second one denies the duplicate, drop it to paper. And then if you have an outpatient claim with services not in the same month, usually this happens if a member comes in the last day of the month to the ER, let's say 10 o'clock at night, and they go home at 2 o'clock in the morning the next day. So it is the last day of the month when they come in, the first day of the month when they go home. The system cannot process 2 different months on an outpatient claim. So that would have to be dropped to paper with the HCA 17. Claims that are past the normal timely filing. So you have 183 days to submit your claim. If you get it submitted and still need to work on it, you have an extra 6 months as long as you send in proof of timely filing. But once that year passes, you can still send that claim in for review if one of these 4 criteria are met: an administrative agency corrective action or action taken to resolve a dispute, reversal of eligibility, investigation of a provider for fraud or abuse, or a court order or a hearing decision. In those instances, we can pay a claim that's over a year old, but again, we will need documentation, and we will also need your proof of timely filing that it was filed correctly in the first place. Okay, now these next few examples are claims that we receive daily, or just about daily, that do not need to be special batched, but they are anyway. And that's claims with standard timely filing. As long as you're within your year, you don't have to drop that to paper for your timely filing. You just need to send us proof that your claim was submitted within the first 183 days. So you can use a copy of the remittance advice. You can go on the portal, pull up the claim and print it off and send that in. Or if you mailed in a paper claim and it was stamped and mailed back to you, you can use that as proof of timely filing. Claims with primary insurance, or TPL. You submit a claim to us, we deny it for TPL, then you bill the primary, get your EOB back. You can go ahead and just submit that on the portal or through EDI. You do not have to send that special batch. Crossovers. If your claim does not cross over or crosses over and denies for some reason, you can submit those on the provider portal. You do not need to send those special batch. And then claims needing attachments, we're going to go over how to send attachments a little bit later. If we do get a paper claim that we need to return to a provider, we have a return to provider letter that will accompany that mailback. We're going to notate on here why we are mailing that claim back to you. And again, the number one reason we have to mail claims back is they don't have legacy numbers on them. If you send us a paper claim and it only has an NPI, it will not be processed. It will be mailed back to you. Okay, so claims with third-party liability. If you're using EDI and the other insurance actually cut you a check and paid you, you can see your loop and segments here. So in the AMT segment and the IO segment, you're going to put the paid amount. So if they paid you $30, you're going to put $30 in that segment right there. We do not need the EOB if you are paid. If you are denied payment, you're going to go to that same segment, but in the amount, you're going to put 0.00. Then you will have to add an attachment to your claim, and a PWK segment will have to be added with an attachment control number. I'm going to go into depth about that in just one moment. If you're using the provider portal, claims with TPL, you have to populate the appropriate fields. So if your claim is a crossover, at the top of the claim, let's say you open up a professional claim At the top, it's going to say professional, and there's going to be a drop down. If you choose an institutional claim, you choose either inpatient or outpatient, it's going to say that at the top. You're going to hit the drop down and you're going to choose crossover professional or crossover inpatient or crossover outpatient, and then fill in those Medicare boxes as you go along. If it's just a primary insurance, it's not Medicare and it's not an HMO. It's something like Blue Cross or Health Choice or Cigna or Aetna, something along those lines. On step 1, there's a field that says other insurance. It's a little drop down. If you were paid by the primary, actually they cut you a check and paid you, you're going to hit the drop down and choose include. Then when you go to step 2, there's going to be a field there for you to put the amount that was paid by the primary, TPL amount. You're just going to put that in the box, fill out the rest of the claim like you normally would. If you were denied payment, and this can be the primary paid the claim, but they put all of the payment towards coinsurance and deductible, so they denied you payment. They did not pay you. You're going to choose denied. In that case, you are going to have to send us the EOB as an attachment. If your claim is an HMO, again on step 1, there's a little drop down that says HMO copay. You're going to hit that drop down. You're going to choose yes. Then you're going to go put in your diagnosis codes, and you're going to go to step 3 where your detail is. No matter how many services you've performed, no matter how many units you used, you're just going to bill one line of service. It's going to be a payable code. Your units are going to be 1, and your charge is going to be the copay amount. Okay, you're not billing us for the services, you're billing us for the copay. So there's just one copay on the unit and the amount is the copay. Then you need to send us the EOB. So any HMO and any EOB that you submitted that denied needs to be sent to us as an attachment. So how do we do attachments? If you're using software, you're using EDI, you're going to have to let the clearinghouse, the billing agent, whoever it is, know that there's an attachment, and then they're going to create an attachment control number and give it to you, or you can create an attachment control number and give it to them. It doesn't matter. But the clearinghouse is going to create a PWK segment, and they're going to put that attachment control number on the claim. Okay, then they're going to submit that batch to us. You need to wait until you see that claim on the portal and it's suspended. Once you see it and it's there and it's suspended, then you're going to print off the HCA 13 off of the public site, and then you're going to mail or fax that to us. So here is the HCA 13. The provider number is your billing legacy number. So again, that's your 100 or 200 number that ends in the alpha character. The client ID is the member's Medicaid number. And then there's the attachment control number. So the clearinghouse put the attachment control number on the claim. Now you're going to put it on the cover sheet, and that's what we're going to use to marry that up. This is why you have to wait until the claim is in the system, because once you submit this, once you fax this into the system, it immediately looks for that claim. If that claim is not there yet, it's going to have nowhere to put it. It's not going to put it anywhere. It's not going to go back later and look again. So once that claim sits there for 10 days, it receives no attachment. We're going to deny it for no attachment. You're going to say, but I've got my confirmation right here. You never get my attachments when I send them. That could be one of the reasons why. The sender's name at the bottom. This is also important. You're not authorizing anything. You are letting us know who we need to talk to about this attachment if we have a question. So it's okay to print your name here. It's more important that we can read it. And then the phone number on how to get a hold of you. Okay, if you're using the portal, on step 3, down at the bottom, it says attachments. So once you put all of your lines of service in, once you get them all added in, then you go down to the bottom where it says attachments, and you hit that plus to open it up. File transfer is the default, and it is the preferred method for attachments by the healthcare authority. It is much faster, it is much cleaner, it's much easier if you have the capabilities to upload. So let's say you have a parental consent form and timely filing. So you're going to scan both of those in. You're going to make them each a file. And then if you can, make another file and put both of those into that one file. It's cleaner, it's easier, it's better if you just send us one file with all of your attachments in it. Then you're going to hit browse right there where it says browse. You're going to go to your documents or your desktop or wherever you've saved this file, double click on it, and it's going to load up on that second line where it says upload file. It'll populate there. Your attachment type is a drop down. So just hit that drop down and choose the applicable line. Then the description, if you tell the reviewer what it is they're looking for, it makes it easier and less likely that they will overlook one of the documents that you send in. If you don't have the capability to fax or upload, to browse and upload your file, you can hit that drop down where it says file transfer and choose fax or mail. If you do that, once you hit confirm, you're going to get your page is going to refresh and look like this. It's going to say suspended. It's going to have the claim number, and it's going to have the attachment cover sheet. So you're going to print that off, and here's some information you need to know. That HCA 13, which is the cover sheet I'm going to show you in just a moment, that is the only cover sheet our system can use. These go into the system when you fax them, and they're basically scanned in immediately. The system knows right where the boxes are it needs to look for to find the information that it needs. If your system puts its own fax cover sheet on there, then your claims are not going to marry, your faxes are not going to marry up to your claim, and your claim is going to deny for no attachment. So the HCA 13 has to be on top. You can also only send one fax at a time. So you need to take your first claim. It can have 8, 9, 10 pages. It doesn't matter how many pages it has. You just have to send one, hang up, call back in, send the next one, hang up, call back in, send the next one. And if your system bundles, if your fax machine bundles, so it basically means that holds all of your faxes till the end of the day and then sends them all at once, you need to disable that feature and make sure you're sending those to us one at a time. This is the cover sheet that you print off. You've got those 5 boxes at the top. They will auto-populate. So if you're using software, your EDI, you have to create an attachment control number. If you're using the portal, the system will create an attachment control number for you. So it will automatically be on the claim when you submit it, and it will be on this cover sheet when you print it off. Down to the bottom again is the sender's name and phone number. Again, just please make sure that is legible so we know who we're asking for when we call in. The second step is adjudication. So once your claim gets into the system, it is assigned an ICN number, attachment control number, a claim number or an internal control number. That's a 13-digit number. We call it a SMART number. The first 2 numbers are the region code. It simply tells us how we got it and whether or not it has an attachment. The next 2 numbers is the year. So since this is 2020, The next two numbers is 20. The next three numbers, 001, that's the day of the year. So 001 would be January 1st. So we can look at this number right here and see 22 means it was submitted on the portal without an attachment. 20 means it was submitted in 2020. And then 001 means it was the first day, so that's January 1st of 2020. So you can use, that's how you can tell if your claim has been timely filed. So if you need to send us a claim with proof of timely filing and you've submitted it several times, you can look at this number and make sure you're printing off a claim that was submitted within the first 183 days. The last six numbers is simply a counting sequence that goes up each time a claim is submitted. So our region codes, your old paper claims started with a 10. If they had an attachment, it was an 11. Your electronic claims that come in through EDI or your crossovers, they're going to start with a 20. If you've pegged them to have an attachment, they're going to be a 21. Web claims are 22. Attachments are 23. That's the portal. Here's some more region codes right here. The only thing I want to point out are the 50s there. Anything that starts with a 5 is an adjustment. And if it starts with a 5-9, that means that someone on your side voided that claim. So if you're looking to see why a claim was adjusted, if it's a 59, somebody on your side went into the portal, pulled up a paid claim, and voided it. Okay, so now the edit process. Now this is instantaneous, but this is what the system goes through and looks for. So once the claim hits the system, however it gets there, it makes sure that there is a provider number, and that provider number is contracted for the date of service and also for the service billed. Same thing with a member ID. Is this a current member ID number? And are they eligible on the date of service? Is the procedure code valid? Is it covered for the benefit package the member has? Does this procedure code require a prior authorization? And if so, is there a prior authorization in the system that is approved for that date of service? The edits continuing. Is the date of service valid? Did you accidentally do a service with 2019 on it, so it's over a year old? Or did you put 2021? Or maybe you didn't know the date and you put tomorrow's date on here when the date of service was actually today. So it's going to check that and make sure it's good. It's also going to look at your referring and ordering providers to make sure they are individuals and to make sure they are contracted for the date of service. And also, if it's a rendering provider and a group is billing, is this rendering provider a member of the group, and are they a member of the group on the date of service? And then a referring provider has to be contracted and also has to be a member of the group if the group is the PCP. Once the claim is paid, it will adjudicate and be placed into the weekly financial cycle for the payment for the provider. You'll get that through EFT. You'll receive a warrant, and the remittance advice will be available to you on the provider portal. For EDI, once the batch passes compliance, the claims will start the adjudication process. So again, it takes a while for these claims to get through. So we request that you give 5 to 6 hours before you contact the EDI help desk for troubleshooting. But if you do not see your claims that your batch has been submitted, it's been 5 or 6 hours, you still can't see your claim, you can contact the EDI help desk for troubleshooting and they can tell you what's going on. The way our system works for EDI, it looks at the NPI number, and then it looks at the ZIP +4. Then if you were assigned a contract code, It makes sure that contract code is on there and it is correct. If you were not assigned a contract code, don't worry about this part. You should know if you have one. Your taxonomy, it also looks for that. You do not need to put your taxonomy number on the claim. The system will get what's in this, will read what's already in the system. However, if you do type your taxonomy on there, it has to match exactly what we have in the system, or else it will deny your claim. So we call this the crosswalk. It looks at your NPI, your zip +4, your contract code, and then your taxonomy, and that's how it gets to your Sooner Care legacy number. If any of those 4 steps fail, we call that failing the crosswalk. So we will be able to see those claims in the system, but you will not. Because it failed the crosswalk, you're not going to be able to see those claims. You can contact the EDI help desk, give them the member ID, the date of service, and the amount billed. They will be able to go into the system, find that claim, see why your batch failed the crosswalk, and then tell you how you can fix it so you can resubmit those claims. And just a taxonomy reminder, the system will pick it up automatically. You don't have to key it in, but if you do, it has to match exactly what we have in the system. If you're using the provider portal, your claims will process immediately. Again, once you hit submit and confirm, it takes literally seconds. Your claim's going to come back and say paid or denied or suspended. If it's suspended, it goes over to the healthcare authority for review. If it is denied, you can actually pull up that claim, see why it denied. If it's fixable, you can go in and fix it right there and resubmit it. Or if you use a clearinghouse and you prefer, you can go ahead and send it back through your clearinghouse. Just make the correction when you send it back, so hopefully it will pay the second time. The audits that the system looks for: is this a duplicate claim? Does it meet timely filing? Is the provider eligible, and are they eligible to render the service that was done on that claim? And can this service only be done a certain amount of times in a time frame, and have they already met that allotment? So those are the audits. So the final destination is your remit. So if you go on the portal, click on the financial tab, you'll see it says RA reports. If you receive your remit through your clearinghouse or through your own software, that's perfectly fine. We just want you to know that they are all available for you here. So when you hit RA report, you're going to get this screen. The box on the right will populate today's date, and the box on the left will be 90 days prior. You can go back as far as you want to look for remits, as long as you've been a provider. However, your search can't be bigger than 90 days. It can be less than 90 days, but it can't be more. So if you move that from box back to 6 months from now, you have to move the to box also. You can't look for 6 months or a year at a time. You can go back that far, but your search can only be 90 days. So once you hit your search, this is the return. Your newest remit is going to be on top. And then that little piece of paper over there that says report copy, if you double click on that, it will actually open up the remit. You'll be able to work it. You'll be able to print it off, whatever you want to do. So if you lose a remit, if you spill coffee on a remit, if you tear it, if you don't have access to it through EDI, you can print it off right here and have a hard copy that you can have in your hand. Our resources, the provider helpline is 800-522-0114, and then there's a local number there for the Oklahoma City area. If you don't know who you need to talk to, or you just have a general question, option 1 is the OHCA call center. so they'll be able to help you with any questions you have. They can also direct you or transfer you to anyone you need to talk to. You can also go directly to the Internet Help Desk by hitting option 2 and then 1. So you'd want to speak to them if you try to log in and your account is locked. Maybe you haven't logged in 120 days or something, and your system is locked up on you. Or if you have a question on how to do something on the portal, you're ready to do it right now, you're already logged in, and you can't get anyone on the phone, you can call the Internet Help Desk, and they can help you with that process. The EDI Help Desk, they do all things EDI. They are option 2. If you would like some on-site training or would like to talk to one of the field reps, there's an email for you, soonercareeducation@okhca.org. There's also a phone number. If you do email, please give us your provider number, your name, your contact number, and also a little bit about what it is you're calling for, so we can have some information when we call you back. The public site is www.okhca.org. They have the billing and provider manual and also the Medicaid on the web guide. We appreciate so much you taking time to listen to this presentation. We hope it was helpful, and you have a wonderful day. Bye-bye.